Hello everyone, welcome back to the channel. Today we'll discuss about a fallen lady. Here is our MCQ. A 45-year-old patient is admitted following a fall from 4-meter height. She has sustained an injury to the posterior aspect of head and has a Glasgow Coma Scale score of 12 out of 15. On primary and secondary survey, you identify a fracture of the left tibia but no focal neurology. You wish to remove the cervical spine collar and spinal board, and so you review the cervical spine films. They show no abnormalities, but the lateral and swimmer's view films do not show the C7-T1 junction. We asked about which one of the following is the most appropriate next step. A. Clear the cervical spine clinically, asking whether neck pain is felt and assessing for neurology. B. Ask for flexion and extension views. C. Continue management on a spinal board and collar until clinical assessment is possible. D. Ask senior clinician or radiologist to review films. E. Clear the cervical spine using computer tomography. Now we'll try to identify the main keywords in our MCQ. So obviously age is a very important keyword. 4-meter height, posterior aspect of head, GCS is 12 out of 15, no focal neurology and no abnormalities in films, do not show C7-T1 junction. So these are the main keywords in our MCQ. Now this is a pure and simple case of cervical spine injury. So when you see a case like this, you should remember Canadian C-spine rule. So if you haven't heard about it, please search. I'll put the link in the description box. And also don't forget to read your NICE guidelines for C-spine injuries. In a case scenario like this, on arrival at the scene of the incident, use the prioritizing sequence to assess people with suspected trauma. For example, use your ABCDE, airway, breathing, circulation, disability and exposure. And keep in mind, at all stages of the assessment, you should protect the person's cervical spine with manual inline spinal immobilization, particularly during any airway intervention, and avoid moving the remainder of the spine. This is very important. And after that, assessment for cervical spine injury should be done. Here, assess whether the person is at high, low or no risk for cervical spine injury using the Canadian C-spine rule. So, cervical spine support is of primary importance when managing a trauma patient. Because of this, the vast majority of accident victims will be brought to the emergency department with a collar in place. And you should know when to remove the collar and when not to remove the collar. So it is acceptable to clear a cervical spine on clinical grounds when a patient is fully awake, sober, alert and neurologically intact with no neck pain. This is a very important point. If the patient complains of neck pain or if their consciousness is impaired, it is a must to perform plain film examination. And if the patient does not complain of neck pain but has a distracting injury, such as in this case, cervical spine films may be taken despite a normal level of consciousness. And for plain films to be adequate, both AP and lateral views of the entire cervical spine, inclusive of the base of the skull and T1 vertebrae, should be there. Additionally, a view through this mouth visualizing the C1 and C2 vertebrae, also known as a PEG view, is required. So failure to meet these requirements or identification of areas of suspicion, then there's indication for a need of a CT scan. In addition, a view through the mouth visualizing the C1 and C2 vertebrae, also called a PEG view, is required. Failure to meet these requirements or identification of areas of suspicion, and then arises the need for CT scanning. Flexion extension films should only be attempted in patients who are fully conscious with normal AP, lateral and PEG views, and they are used to identify areas of occult instability. They are contraindicated in patients with an altered level of consciousness. So these points are really important. So back to our MCQ. Answer A, clear the cervical spine clinically, and answer B is ask for flexion and extension views. So as we discussed earlier, we can't ask for these as the patient's conscious level is not 15 out of 15 according to GCS score. It's 12. So these answers are excluded. And answer C, so leaving a patient on a backboard for over 2 hours puts them at risk of development of decubitus pressure ulceration. And also remember that the risk is particularly high in patients with a reduced level of consciousness. Therefore, the best answer here is E, clear the cervical spine using CT scanning. So that's all about this MCQ. Please read around a bit about cervical spine injury and read the NICE guideline also. I'll put the link in the description box. So I hope you understood this MCQ. If you like this MCQ, please hit the like button and don't forget to subscribe my YouTube channel for more videos like this. Let's meet from another MCQ.